Hi, everyone, and welcome. Welcome to today's webinar about alcohol policy, demystifying alcohol policy strategies, planning and implementation. We'll just give a couple of minutes for everyone to get into the room and settled in for our webinar today. And Maureen, if we can go to the next slide, please. Excellent, thank you. So welcome, everybody. Welcome to today's webinar. So we ask as you're joining the room to please put your name and organization in the chat. And then I'm going to pull up our welcome poll for you all. So today's poll is what keeps you from pursuing alcohol policy strategies? So as you're coming in, if you could please type your name and organization into the chat and then answer our poll, that would be lovely, and welcome. Excellent. Super. Again, welcome to those who just joined. If you just joined our webinar today, we are asking you to please answer the welcome poll, which is what keeps you from pursuing alcohol policy strategies, and then entering your name and organization into the chat.
Wow, it's so great to see everybody here and look at getting a great response to the poll. Thank you so much. Thank you, Shannon, for getting us started this morning. New Mexico, West Virginia, Michigan. Y'all, this is amazing. You're from, wait, was that Kenneth Young? Yeah, that's that in my city? Oh my, wait, did that say Hawaii? You are up early, friends. Ohio, Vermont. We have so many. Oh, there's so many people. Thank you. Springfield, Massachusetts. Oh my goodness. Oh, Todd, you're definitely where I thought you were. Okay. Well, this is amazing. Maureen, should we take a look at this poll?
I think that would be great.
Great. So we have about 75%, 78% response. So if you haven't done it yet, please feel free to do that and just share with us what keeps you from pursuing alcohol policy. And it looks like kind of by a good margin, we are looking at people who are saying they really need the skills to implement policy strategies. So those, the understanding, the skills, and I'm guessing some of those soft skills too around how to do the work. And a close second is the readiness of the coalition to do that work. And that's another really hard piece of this. Great. Well, that's about 87% of the folks, which I think is just fantastic. Thank you for taking the time to answer this question. Wonderful. So great. So I think, Maureen, then we kind of know where we're going, right?
Yes.
Wonderful. I'm going to turn it over. We'll close the poll and we can turn it over to you. We still have people coming in and putting their name and organization. Thank you so much. As per usual, our disclaimer here is that we are funded by SAMHSA, and our work here today and what we're sharing here today are the opinions expressed are the views of our speaker and do not reflect the official position of the Department of Health or DHHS or SAMHSA. So no official support or endorsement of these opinions should be prescribed to SAMHSA and is not intended to be. With that, I want to remind everyone that here at the Great Lakes PTTC, we believe strongly that words matter, that words have power, and that we use people first or person first language. So we use affirming language to promote application of evidence-based and culturally informed practices. And we ask that in your communications in the chat today that you also remember and keep in mind the power that your words have. Thank you for joining us. I've already said that like 3 times, but anyway, thank you for joining us. Just a few quick things. We do have Shannon Cassidy on the line, who is fantastically helpful. If you have any technical issues, please use the chat at the bottom of your screen to message her directly. just so that she doesn't lose or your chat doesn't get lost in the number of chats that we're seeing. So please take a minute to do that. If you need captions or a live transcript, please use the Zoom toolbar near the bottom of your screen. And under the more, you can open that up. Questions for the speaker, we're going to be using the chat today. We have a lot of people on the line, which is fantastic. So we want to make sure that we take the time to ask those questions while we have an expert on the line, but let's go ahead and put those in the chat. Shannon and I will be monitoring them. We do have a short survey at the end of this webinar, and it is incredibly useful for us for you to take those 3 minutes and complete that. We want to continue to improve and provide the information and support that y'all need and want. So please take that time so we can understand how well we're doing. We will be providing certificates of attendance. They'll be emailed out for those who attend the full session. So that means that you are on from now until the end of the session. We also ask that if your name does not appear in your box correctly, if it's an agency name or a phone number, please take a minute to make sure your name is correct so we can ensure that we get a certificate attendance, not to a phone number, but instead really to you who's been on the line. It can take us up to 2 weeks to provide those certificates. If you don't see them in 2 weeks, feel free to email us, but please give us those 2 weeks to get those out. And like we said, brought to you by SAMHSA. Yay! Okay, I'm going to turn it over to Maureen to talk about our objectives for the day and really get us started. She's our expert. She knows all about this topic, and we're really grateful to have her here today. So I'm going to stop talking, and I'm going to turn it over to you.
Okay, great. Thanks so much, Erin. And it's wonderful to see folks from all over the country. I saw some folks from Wausau and Ashland in Wisconsin, shout out. But, you know, seeing folks from Oregon and Michigan and everywhere. So thank you for coming today. So in the past couple webinars, we have talked about model policies and some of their components. I'm going to talk a little bit more briefly about that. And then talking about the role of leadership and implementation of policy, describing the importance of understanding opposition in policy implementation. So who's with you, who's against you, who's, you know, lukewarm, and defining strategies to counteract existing harmful policies. So we'll be talking about all of those things. I did just want to say, before I get, you know, deep into this, that I saw that you all said you didn't have the skills. And I think you do. You inherently do. You know, as a kid, you'd ask for what you wanted. Hopefully you still do. That's the first step in advocacy. That's the first step in trying to move something forward is, you know, you might ask some questions, but then being just able to make those asks. And sometimes it seems hard, but once you get used to doing that, it does come more naturally. So I think inherently as people, we have a lot of these skills. It's a matter of bringing those out and feeling as comfortable as possible with them. So this is just my background. I think many of you have been on this before. I'm at the Wisconsin Alcohol Policy Project at the Medical College in the Comprehensive Injury Center. And it's really a great place to be, very supportive of public health. And we have suicide prevention, community safety, violence prevention, and data and informatics, which is incredibly helpful to the work that we do. And I'm also very engaged with the Public Health Association. All right. Steps for success. So you've seen this slide before, you know, where we're talking about identifying the problem in the community, building that leadership, determining where you make the change, and identifying your decision makers. So I'd be interested if some of you wanted to share in the chat, how are you getting started? You know, have you been doing some of this work? Or, you know, I know a lot of you in the first webinar said, you know, you hadn't had policy experience. So just interested if folks wanted to share a little bit about where they are in that process. I also discussed model policies in the prior session. So thinking about the community guide, county health rankings, which is what works. We also have a statewide one for excessive alcohol use that we've used. And the issue with model policies is, you have to make sure it's going to fit within your regulatory environment, obviously. But the key thing from kind of a policy campaign standpoint is, what is the most important thing that you need to get done? And thinking about that component and how that language gets expressed, you can get help with that. Clerks and legislative offices, there's often like a reference bureau or that, they can draft that language. So that's not generally something you have to do. You have to have the ability to read it and make sure that it says what you're looking for. But the important thing to think about ahead of time is, what is that most important thing that you need to get done? And then there's probably some pushback. So there may be things that you need to compromise on, right? So I want you to just think about that for a second. I'll give you a couple of examples in the past. So I've run a couple of tax campaigns for tobacco. And our main goal was to make sure that we had an ability to reduce underage or kids from starting tobacco, because it would be too expensive. And we knew from research that 10% of the product price was that flip point where you started to see youth not taking up tobacco as much. And so that was our bottom line. We had much bigger tax campaign numbers put out, 85 cents, and we did $1, but we knew our bottom line was 40, because we were able to, make that compromise and know we would still get what we needed. We ended up passing a couple of different tax rates and way above that 40 cents on a pack, which was great. But then when we started working on the smoke-free air law, if you compromise who's covered, you're leaving people out. And so that was not negotiable, right? We needed to cover everybody. And so when you think about those model policies, you want to make sure you understand what is the most important thing and what can you compromise on, because they're going to push you to do so. And for that, it was like implementation date. We could push that back. It's not great when that happens, but it would work. And so we were able to pass a pretty strong smoke-free air law. So just thinking about, as you're looking at different policies, what are some of those most important pieces? I'm going to talk a little bit about some of the policies that we're working on right now. And they don't always involve decision makers in terms of elected decision makers. They definitely involve decision makers like chief of police and the sheriff and those kinds of folks. But I just wanted to sort of talk a little bit about that. The other thing I did want to just give a disclaimer is I talk a little bit about coalition building in this talk, but there are complete series of webinars on coalitions. And I'm going to kind of make the assumption that you either have a great coalition or you're building a great coalition, but that you have resources to do that. So any of this work absolutely has to have coalition building, but I did want to get to other topical areas. So I wanted to make sure, that I put that out there. So were there any sharing in the chat, Erin, that I should take a look at?
Sorry, I was on mute. I was saying such good things. I was on mute. Apologies. Yeah, so we do have some great things in the chat. I just lost it. We had, oh my goodness. Home delivery state laws inspired a group of us to start Alcohol Wide Policy Alliance and Public Health. So we're hearing that from Michael in Georgia. That's really great to hear. Looks like that's about it in terms of folks who shared what kind of got them started on the work. Make sure I didn't miss anything.
That's great. I think it's really important to make sure you're targeting, as you look forward to the folks in Georgia, some of those key legislative districts, and making sure that you've got people in those places to make some noise and to educate their lawmakers and the community as well. Because that's how, I've been a lobbyist in the Capitol, but I feel like the most important work happens outside the Capitol. So it's really critical to make sure you're thinking about who are some of those key decision makers in the legislature that need your attention. Sometimes our state is kind of purple red and so we'll have a lot of support from some of our larger cities, but that's not necessarily where leadership or some of those key folks live. And so it's really important to build up all over the state. That would be my one thought.
Great. There are a couple of mentions of coalitions here and collaboration, and I think you touched on, we can only get to so much, and so we made some decisions about what we would get to today. The Great Lakes PTTC and other PTTCs around the country are definitely working on trainings and resources around coalitions and coalition building. So that's what I think I saw. So we can keep going.
Okay. So I know this might not seem like the biggest thing, right? Talking about the problem, but the narrative about the issue is incredibly important. So, at this point, you've decided where you're headed. Maybe it's working on getting SBIRT or SBIR into the schools. Maybe it's getting the police, law enforcement to work with the coalition to do alcohol age compliance checks. Maybe it's place of last drink in terms of a policy. Maybe you're ready to run a tax campaign. But what you have to do is push back on that big narrative that comes down. Certainly in our state, alcohol is not seen as a problem, but we've got to talk about the problem. And so I think that's really important. So it's really critical to stay focused. And that doesn't mean that you don't talk about kind of other things related to alcohol, but it does mean that you try to bring it back to why what you're working on is going to be helpful in the long run. And I also find that people do like to solve problems. So sometimes people say, oh, you bother them, you're always asking for, engagement in a coalition or whatever. But this is an opportunity to say, look, our state could do so much better, right? Our people could be more productive. Our workforce could be so much better if we weren't binge drinking so much, or, whatever the issues in your area or your state. So let's help people pull together and solve problems. So taking that kind of positive approach. And then I think being clear and consistent. So one of the things that, as someone who's worked on many campaigns in the past, you say the same thing over and over and over again. And you need to say the things over and again. You need to obviously keep it fresh as much as possible, but you do need to kind of have a message wheel and be able to talk about it and be clear and consistent. So if you're talking about alcohol, try not to get into other issues. And it can be challenging. And that's why I bring it up, because your conversations, your media interviews, you're talking on the radio, all of those things, it's really important to keep getting that message out and say some of those same things, in fact, because you need to change the perception of the harm that excessive alcohol use is in our communities. So, and it is easy to get pulled into other issues. And I'll just give you an example, and I apologize for all the tobacco examples, but we ran a lot of campaigns in that area. When we would start working on smoke-free air, people would talk to us about the economic impact. Now, we knew the research about the economic impact, and we know that it didn't have a negative component for these businesses. Some businesses running on the edge might not make it, but they were already running on the edge and they might not have made it no matter what happened. But we're not credible in that area. So we were able to bring the Restaurant Association on board. They wanted, instead of a patchwork of local smoke-free ordinances, they wanted either a statewide law that says everybody smokes or nobody smokes. So we convinced them that nobody should smoke in indoor spaces, and they worked with us, and they could address that economic question. So that's kind of, in terms of building your coalition, building your supporters, thinking about who can also be talking about issues that you're not really as credible as talking about. And sometimes it's giving folks data, but also sometimes it's really them having to do it. So there's an example of a small community. They had gotten a drug-free community grant, and the police weren't really engaged. They weren't really believing it, mostly because the chief at that time wasn't that interested. And so they are like, oh, our retailers are really good. And so they kind of had to end up challenging them and getting them to go out and do alcohol age compliance checks. They had a 75% sell rate. So that changed the conversation completely with law enforcement. So sometimes it's about taking those actions and showing them, hey, what's going on, and seeing it for themselves. That will help get them to start talking about the problem in a way that is helpful to your overall work. I know we've already talked about this, but it's so critical. I bring it up again, building from the ground up. And I'm going to give you a couple examples. We had 2 referendums on smoke-free air on the same night. One in Stevens Point, University Town, and one in Marshfield. And Marshfield has, a major clinic, and both communities had a lot of other smaller industry. And Stevens Point, I told you before, there was a priest who said, if we pass the smoke-free law, we won't be able to burn incense. It's a heavily Catholic community. And the coalition did not have other religious leaders to say that's actually not the case. And so then the Tavern League went to work and that referendum failed. And to me, that was also a failure of having people from the ground up, and having different sectors and different perspectives able to reach out. In Marshfield was not the same thing. That campaign, instead of being led by the health system, was actually led in part by a family. Their son was born with some sort of genetic issue, and he could not be exposed to secondhand smoke. It would make it impossible for him to breathe. And his grandpa was like in the Marshfield Bowling Hall of Fame. Like, bowling was a huge family event, and a lot of celebrations around that. And so this family wanted to see the law change so their son could breathe easy and join his whole family in this sport that they all did. Now, that campaign also definitely got support from the health community and other communities, but it was definitely, most definitely a grassroots push. And they won, and they didn't win a little in that referendum. They won a lot. They won more than the open seat for mayor. They had more people voting on that question than anything else. And so obviously that passed. And from a statewide perspective, so thinking about the folks in Georgia or others of you that are looking at statewide, that changed the game because it was northern Wisconsin that voted overwhelmingly for this referendum. And it was not an advisory referendum. It means once it's passed, it's the law. And that just changed the game. So again, building from the ground up and having a number of different sectors engaged is just critically important. So we've talked a little bit about leadership buy-in already. And as I emphasized before, I'm not just, you're definitely going to work with your lawmakers or decision makers, whoever that may be. But I'm talking about some of those nonprofit leaders, those credible leaders in the community, maybe it's the hospital and the hospital CEO. You know, it could be a variety of folks to do that. So this is really important to get some of those leaders together and be able to have them work and support this. Sometimes they do it quietly, you know, where they give money to a campaign. Sometimes they are outspoken, but having their support is really critical. Maybe they're the kind of folks who can whisper in ears and be helpful that way. But you have to show the impact of what we're doing. And so one of the things I recently looked up, because I would look up the community that we were working in and say, how many OWIs do you have? And how many fatal OWIs? So that's operating while impaired, I'm sorry, in Wisconsin. I know other states have DUIs or whatnot, all kind of the same thing, hopefully. And I look up the number of fatal, and I looked up how much on an average does a fatal OWI cost. It's $1.75 million. Now this comes from, I'm blanking on the reference, but I'm sure we have it in the notes, and if not, I'll make sure it gets there. If you could stop a fatal OWI for multiple reasons, right? People shouldn't be dying on our roads because they've had too much alcohol, but the whole cost, the trauma to the family, the law enforcement time, the courts, everything that goes into that, it costs us as a community the loss, but also it costs real dollars. And sometimes people need to hear that impact. It's like, you know, if we start doing these things, we may be able to bring down the number of OWIs we have, and it may be able to reduce or hopefully eliminate fatal OWIs, right? That's where we want to go. So that's kind of impact. You could also talk about ER visits. You know, what does the average ER visit cost? And focus on reducing something in a tangible way. You know, and that can be very helpful when you talk about impact. And then kind of the return on investment. What will it save the community? What will it mean for families? You know, it kind of depends on who you're talking to. But there are certain people that you have to talk the numbers. And so I would encourage you to make sure you pull those numbers up and look at those. Because there's this argument about economic development, and I bet many of you have run into this where it's like, well, they've got to sell alcohol. That's the only way, you know, you can make money. What they're not thinking about is by having more and more places that sell liquor or allow you to consume liquor on site, on premise, they're not thinking about the cost on the other end of that, whether that's child neglect, whether that's additional violence, it's, you know, fatalities, suicide, you know, all of those things. If we can reduce that, that's a huge return on the investment of making this change. So again, trying to kind of flip that economic development. Well, do we have enough police to manage this? You know, and being able to make some of those arguments and discussion could be very helpful, I think, in terms of how you approach it. And it's also important to know who you're talking to and what is important to them. So when you start kind of engaging some of these leaders in different sectors, that's what you want to ask, right? You want to find out, what do they care about? And then you can focus on what area, if we are able to reduce excessive alcohol use, how do we then kind of show them the impact on the people they care about, or the dollars they care about, or, you know, whatever that might be. So again, how do you influence and, you know, focus on these different sectors? How do you get alcohol to even be a topic? And that's where I think many of you are probably placed in a place where you can do a report, right? A white paper, something you can release to show what the problem is in order to get the conversation started. And I think those are, and if you can't do it, some of your partners should be able to do it, right? And to be able to show the importance of making some of those changes. We in Wisconsin did a binge drinking report, which showed how much binge drinking costs and broke it down by the county level. That's extremely helpful. I know our quit line in tobacco actually does the number of calls based on assembly district and Senate district. So you can, show what is going on in the community and how much people need these services. And wouldn't it be great if we didn't have so many people that needed these services by making these policy changes, right? And so as you think about your work, it's important to also not think of one person in an agency or in a sector and being able to assume full support for that. When I was doing a lot of work in systems change, we found that you really need to have multiple people engaged in each agency. Now, I know everyone's like, you're piling all of this on, but here's the thing, right? From the person who answers the phone to the person with IT who sees people, right? All of those folks need to be part of a systems change. And while we want policy to change, the only way it sticks is if everybody is moving in that direction, right? And so I think that's kind of one of the tricky things. It's not enough to know the school resource officer in the police department. You really need to know who trains. You need to know the chief or the sheriff, who's actually overseeing maybe the third shift. Could be super helpful to you. If it's a school, obviously there's a number of different partners there that you're working with. So I just wanted to give you a couple of examples to help you think about, it's important to have some of those top people, but it's also important to have people who are actually doing the work. They can bring examples to the conversation that would be helpful, and also think through any kind of challenges that you might have as you're working through the campaign, and then obviously passing and then implementation of these changes. If folks wanted to share a little bit about, are you working on the local, state level or federal? I'd be interested to see kind of where folks are at on that. I do see go ahead, Erin.
So I'm so sorry. It looks like we have some people working at the state level, which is great. Local also so important. This alliance is working at the state level, local and state, local, state, local, state, local, state, local, state, local, state. So it sounds like all three from Michael. A little bit of state, we see local. So it really looks like that that national or federal level might be not a priority or not a reach that people can do at this point, but we're looking at a lot of state and local work happening.
Right. And of course, it depends on how your regulations are set up. You may have to work at the state level. There's not really an opportunity to do local level change, if you're a control state. But having local, if it's possible, having local campaigns to be able to make some of the changes you want to make, getting many communities doing alcohol age compliance checks, for example, and sharing, what changes that they're seeing. Collecting place of last drink data, and then being able to go to the state and say, hey, let's do it that way, can be really helpful. But if you have to work at the state, you have to work at the state level. And then that's a matter of breaking that down and looking at like who makes some of the most important decisions in this area and what kind of local connections do you have. What the great thing is about having statewide partners is that they often have contacts in places where maybe you don't, right? And so then it's a matter of kind of bringing all of that together. So that's the beauty of working in a coalition. And all of this applies to the local level as well. Different, sometimes so I'll just share a little bit of a, maybe it's not a secret, but we've had city council members get really excited about something and they want to have it go through. And I love them for that. But if we don't have people that are ready, so I noticed a lot of folks said, you know, your coalition isn't quite ready to move in that way. We don't have enough gumption to get that change to happen. And so you have to really spend the time building that local support, and it may be divided by district, right? So that you've got people that can talk to people that elect them, or that are key stakeholders for whatever system you're looking to change. You know, maybe it's in the schools and you need more teachers, or you need more parents engaged in that. So just thinking about, you got to break it down and thinking about who makes those decisions, and then how do you work up in order to get to the folks that make the decision and make it easy for them to do that, right? You've changed the environment, you've changed the conversation about policy so that they feel more comfortable going forward. So I think I've touched on this a little bit too, but wanted to go a little bit deeper today on this. What is the understanding of alcohol-related issues? Our organization works a lot on preventing violence, for example, and I don't think people recognize how much alcohol is involved in violence. So it's very important to get that data, right, and be able to share that and use that as a door opener. Come and give a presentation, but then walk out with names of people who want to learn more and maybe be part of something to help change how many Class A liquor licenses you have in an area that has a lot of violence. It's not a coincidence. And so I think that's, you know, some key ways of thinking about how do you increase the people that you need, their understanding of alcohol-related issues. So again, that goes back to listening to what people care about, and then seeing if there is a connect. Sometimes there isn't, sometimes there is. Most of the time there is, I think. Readiness to make change. There's actually a number of tools out there that you could look at to think about how well your coalition is in terms of being ready to make change, but also thinking about, so one of the things we've done in the past is actually just kind of interview city council members and find out their attitudes. So it's not asking them yes, no questions. It's really just understanding where they're coming from, what their priorities are, and how much they're ready to make change. Because the work we do is change making. It's uncomfortable, right? To go away from status quo. And so I think that would be important. In terms of readiness, Americans for Non-Smokers' Rights has a really great readiness tool. I believe there's a number of other resources out there. I'm sure Erin is thinking the same thing, that can help you do some of that assessment and help people get to the point where they're ready.
Absolutely. That's something we can look for and share post-webinar. I know we have that, but I can't put my fingers on it at the moment.
And then thinking about resources available for policy change, that can be many different kinds. Financial, of course, you need people dedicated to be able to work on this stuff. And yet I've also seen volunteer organizations do amazing work. So they may need different resources to make that policy change. So maybe it's part of just building that grassroots, kind of learning how to organize and get people to be part of the change. Every time you go out and do a presentation, make sure you bring names back. Make sure you ask for some concrete steps that people could take. so that you can continue to build support for the work that you're doing. So thinking about, what do you need to make policy change? There's a lot of resources out there to help you think this through, in terms of just like talking about coalition building, the type of policy that you want to look for, those kinds of things. But what you also need in your own community is to think about who knows who has what relationships. And again, there are tools to help you do some of those. I'm doing a circle, right? Because it's the circle of influence that we all have, and kind of taking the time to write that down. So there's a lot of different resources available, and funding can definitely be part of that. Policy change doesn't mean always lobbying. The biggest amount of work, frankly, is everything you do minus the lobbying. The lobbying is a piece of it, but what we're doing is building information. We're changing the narrative. We're building relationships that lead to policy change. So I know that, and I apologize, I was looking for this resource, but looking at a study from the CDC looking at tobacco control coalitions, and they found that communities had already changed their mind, meaning people in the community had already said, we want a smoke-free law, before lawmakers got there. So we are leading lawmakers to make policy change for everybody to be healthier. And that comes from those relationships, challenging some of those cultural norms, and doing those things, and understanding who holds power in different areas and how you can work with them or mute them if necessary. I'll give you an idea of what I mean by that. So in our state, there's a large chamber of commerce, the statewide one, that really has the ear of a lot of our lawmakers and business people. And so we came to them with data to show how much harm smoking does to the workforce, and how much cost it is for employers to deal with people who are smoking. And the argument was, if we were able to raise the tax, we would be able to reduce the number of people smoking. And so that would be good for you. So all we wanted you to do is just zip it, right? Just stay out of this part, because in the long run, it's going to help your workforce. And they agreed. So sometimes it's not just getting people on your side. Sometimes it's just getting certain people to not be talking as much. And then obviously, those who have past experience with policy can be just a gift, especially if they know the folks that you're trying to help make change on. They can give you great insight. And so welcome those folks, to your table. So hopefully that kind of helps in terms of getting to know your sector a little bit. So now thinking about decision makers, and now we're going to kind of start thinking about those people who vote on things or can make things happen in your community. So at this point, you have a strong coalition. You have a lot of folks from different walks of life and different sectors coming together to work on something. You're working on changing the narrative. And now you got to lift up and look at, we need to know these decision makers. We need to understand them. We need to know kind of where there may be common interests, and where there might be a connection. Just because you're working on this issue doesn't mean everybody cares, right? Or that they don't think it impacts them. I would argue that everyone's impacted by excessive alcohol use, but sometimes people don't see it. And so I think it's critical to understand them. And as I've said in past webinars, follow them on social media, go look up their web pages, LinkedIn, go find out about them. Of course, the big thing is go meet them, right? As someone who's lobbied, we would often laugh about how people would be intimidated about meeting legislators. And we're like, if you only knew them, they're just people like us. And they usually have some charisma, right? And, that help them get to where they are, whether it's elected position or just a high level position, a chief or a sheriff or CEO or whatnot. But if you come in understanding where they're coming from a little bit, that can make that conversation go easier. And again, let them tell you things. It's amazing when you ask people some questions, what they will tell you, and you can start to see where there might be like that Venn diagram of being able to see how you can work with them because there's an intersection of interest, right? I've learned over the years that just because they might not agree on a particular policy, they may agree on the next one. So I always try to keep those doors open and those conversations going and leave them always in a good place. So if there's something that is a common interest, I come back to it at the end. In Wisconsin, the classic is go Packers, right? But hopefully you actually have something a little bit closer that makes sense. Also, as you start getting to know those decision makers, also see who's also around them. Certainly if you're working on the local level, that can be a little bit easier to figure out what kind of community influences them. Who they might be liking on social media, who they might be following. That can be really helpful. And then some of the decision makers that I absolutely love are sometimes not in positions of power. And so over and over again, we have these great champions and they love public health and they love data and they're not in power. And so that can be discouraging. So that's why I say, like a city council member comes and says, oh, we would love to do this. And I'm thinking, okay, you're not in a leadership position. I'm watching the council vote down your proposals because I've been going to city council meetings to see what's happening. So you've got to be careful with that, right? So that you find additional supporters before you start introducing a bill and make sure that you've got the grassroots ready to go if you need it. And so I think that's critical to have an idea of what they're working in, what their environment is. Go and watch it. You can sometimes watch online, but the advantage of going in person is that they see you and that you're interested. You're not just there for your issue. You're there to just learn about what's going on in that decision-making body. Vikings and bears, we'll let that go. The other thing that I think we know this, but we sometimes don't recognize it, is when we're building up to go talk to a legislator and we think they have the answers. And they don't always. That's why they need us, because they can't know everything. Their specialty isn't always in the work that we do. If you look at who's on city councils or even state legislatures, you see farmers, you see businessmen, you see accountants, they don't know anything about public health potentially. And so that's why it's important that we're part of that process. And of course, as you know, these problems can be super complex and they may have interests that are counter to what you're trying to do. And sometimes you won't know that. The accountant could have a huge, beer wholesaler client, for example, and you don't know that. So they could be sympathetic, but not really helpful because they have a different interest, right?
And just to add on and ask you a little bit more, is as you're talking through this work and working with these legislators, making these connections, is this the fine line that we walk sometimes between lobbying and advocacy? And how does that, and how do we ensure that we stay on that one line? So I just wanted to see if you could share a little bit about how that we can ensure that we're not crossing a line that is uncomfortable or not allowed from our
Right.
funders.
Yes. So again, looking back to that first webinar on lobbying, you need to know what the rules are in your state and what rules are, with your local and state government, and what the rules are in your organization. So I think that's really important. So sometimes it might not be you talking to decision makers, it may be members of your coalition that are talking to decision makers. So that, and I use you kind of broadly in that. And so that's also an important role. And I think assigning people roles is really important so they have tasks and they can stay focused. Depending on your state rules and how you're funded, because there's some restrictions with federal funding and like how the state works in terms of contact with certain decision makers, like a state legislature that you have to be mindful of. Now, remember, the active lobbying is the two things, right? It's specific legislation and an ask. If you are trying to just find information and say you're interviewing a number of different people, in your community to find out attitudes on something, as kind of a research project or just research for the coalition, a lot of that may not be applicable. But again, it's up to the rules that are in your state and being mindful of any federal restrictions that you have. Does that help? Hopefully. I'm going to take that as a yes.
Yeah, I think that helps. Thank you so much. And what I've heard from you all along through this is really about making clear what sharing information and getting them to understand the issue. So I just wanted to kind of get that square in my mind and see if everyone else needed that. So I think thank you. It was really helpful to hear that perspective. So thanks, Maureen.
You bet. The other thing that I find a lot of decision makers, and this would apply again, everything from school principals to other heads of organizations, and certainly legislators and city council members, that they can be incredibly impacted by the current crisis, whatever that may be, being flooded. It's going to take all of their focus in a different area. So pay attention to what's going on in the world and what's going on in your community. And you may have something planned, you may just have to cancel it because that's just how it is. If there's major floods or, other natural disasters, other kinds of disasters, where a mayor is being ousted, that kind of thing, you're not going to get people's attention. So just be wise about that and, pull back. Because I think that, couldn't give you a little bit more time to work in the community and build more of that support, depending on the sectors and depending on how well or how much other people are impacted by a current crisis. So just be mindful. We were bringing in a famous cyclist before he was discredited. His name was Lance Armstrong to town to talk about going smoke free. And how he was very much a proponent of doing that. And Brett Favre, who was the quarterback for the Green Bay Packers, decided to retire that day. So everyone who interviewed Lance Armstrong wanted to know what he thought about Brett Favre's retirement instead of what he thought about Wisconsin going smoke-free. So even the best planned kinds of things can just not happen. And it's frustrating. But that's why you make sure that it's not just one event, right? So we had, and again, this is before the whole drug thing came out from Lance Armstrong, but he took pictures with legislators. You know, there were some private meetings, you know, that kind of thing. So it wasn't just the large events we had planned. So there was still things that we were able to get out of the investment of that planning and the time. You know, it wasn't just all about the press, but it was really, you know, crushingly disappointing, you know, when those things happen. But you just have to be flexible and kind of roll with it. And then again, talking about multiple relationships, the decision makers you're talking about have multiple relationships too. Maybe they have ownership in a bar, or maybe their aunt runs some sort of franchise, you know, that sells alcohol. So I think you aren't going to know all of those things. And I wouldn't want you to spend all your time trying to figure all of that out, but understand that that can be in how people are reacting or maybe not looking as supportive as you think they would be, because there might be something else going on in the background. So part of when I'm talking to decision makers, and especially when it's going to be a vote on from multiple people, I don't need everybody. I just need one more. And so think about it that way. Make sure you've got your yeses, you understand who the no's are, and you pull the maybes that you need over. Obviously, you want to win by more than that, but I can tell you in Wisconsin, running all of those local smoke-free air campaigns, we often won by one vote. We still won, and that's what, you know, mattered. And again, the public was already there waiting for politicians to move forward. I love this slide. Where are your decision makers getting their information, and where are you sharing? Are you getting into the same places that they're reading about? I think that's just critical to think about. And kind of who's in their circle? Who are they listening to? I would sit down with your coalition and literally do the exercise about the connections that they have. We recently did this in a Board of Health meeting, and they found that somebody has a neighbor who's extremely influential to people that we needed to vote in a particular way. It may not mean that we can get them to vote that way, but it may mean we understand what's going on. So it's really important to understand your own circle of kind of influence, as well as everyone else's in the room, because they may have connections they didn't even think about until they do that exercise. So the people that you want to move, who are they listening to, and who do you have? And then thinking about events. You know, sometimes they have those open office hours and that kind of thing. And sometimes no one shows up. So show up. Whether it's you or your coalition members, show up. And I think that's really important to understand what events they are. Obviously, there's limits on, you know, if you know that they're going to be at a festival and you don't feel safe there, that kind of thing, you know, certainly don't do that. But events that, you know that they attend, it's important to show up. All right. If there's any other questions, you know, kind of keep putting them in the chat as I move ahead here. So I'm going to talk a little bit about both implementing and passing and implementing policies, and some ideas about methods of organizing your kind of campaign. I use campaign loosely. I don't mean that it is necessarily a legislative campaign, but as you think about the policies that you want to get changed, you're essentially building a campaign in order to move things forward. We're working on getting statewide place of last drink put into the Department of Transportation system that all our law enforcement use in order to make it easier to understand where place of last drink is happening and make it easy for every agency in our state, law enforcement agency, to track it, right? So that is a campaign. But it doesn't mean, you know, like it's a political campaign. So organizing yourself and your coalition, I think, is critical, so that you're making the best use of people's time, energy, and resources. So there are a million different ways to organize. I tend to like the Midwest Academy strategy chart. There is a Midwest Academy strategy training on the chart that is a week long. So, you know, this is just kind of giving you a little sample of the simplicity there can be, but a lot of this is very complex as you dive deeper. They are not the only one. There's lots of them out there. Find one that you think would work for you. But really what it's like, what is your goal? And you should think about what are your short-term, medium-term, and long-term goals. Organizational considerations. Who does what best? Don't put people in a place where they're doing something out of, you know, kindness to the coalition, but it's not really where their strength is. If you need some other strength, go and get it. Go find other people. But organizational considerations can be, you know, what kind of money can be put in, what kind of human resource can be put in, what kind of connections. So not everyone does the same thing, and not everyone brings the same assets to the table. So making sure that you have a good understanding of your folks. Constituents, so who's kind of out there waiting to be organized, right? Who are our allies? And I think of, when I think of kind of the heart of the coalition, you know, it's maybe 5 or 10 partners coming together that really decide. And then you've got kind of the next step, the people who want to be involved and engaged in certain things. And, you know, and then that circle continues to go out. And so by making sure you've got a good understanding of where people are at, again, by listening to them and hearing where they're at, then you can still call when you need help from someone kind of outside that circle, but is still being connected because you're communicating to make sure that they can follow through on something that you need to have happen. I just think of times when things have gotten scrambled in a legislator's brain, and I needed the Dental Association to reach out. They didn't attend our, you know, weekly coalition meetings, you know, and I think they just read the minutes and kind of paid some attention. But when I asked them to do that, because they were still part of it, and I made calls every now and then to make sure, you know, that we still had them engaged, they took immediate action and cleared it right up. You know, so just thinking about making sure that there's those connections with all kinds of different folks. And then opponents. And I want to say a little bit about opponents. You can spend a ton of time looking at what the opposition is doing. I like to assign that task to somebody to kind of keep track of things. If you have a good plan, you need to know what the opposition is doing, but you don't need to overthink it. If you do your plan right and you get all of the people moving in the direction you need them to, you count all your votes, or have the decision makers moving in the correct place, you can deal with opposition, but don't obsess about opposition. They waste a lot of time on various things that you might need to bat away from time to time, but focus on moving you, your organization, your coalition forward. I realize we don't generally use target anymore when we're talking. In this case, is who are the people that you need to look at that can make the decision you want made, right? So just putting it down in writing, and then thinking about, you know, what are the tactics? And people love to talk about tactics a lot instead of like looking at that larger sort of strategy. And it's easy to do. I do it sometimes too. But tactics should not run the strategy. The strategy should be run by who you're working with, what the opponents are likely to do that you can swat away and focus on your strategy to win what you need to win. And always be ready. I remember when we got healthier lunches, then all these stories came out about how football players weren't getting enough calories. You just never know what might come up. And that's where you want to, pull in some of your experts and have them help, respond either themselves or be able to use some language from them to help you deal with that. So you just never know what's going to happen. So that's why you want to, again, make sure that even people who aren't involved on a regular basis are connected in some way or fashion, so that when you need help, they're supportive and that you can count on them to do so. Also think about being ready for opportunities. So I think, when I think about being ready for opportunities, of what the alcohol industry did during the pandemic. They saw a major opportunity, and they had already been doing all of this. They knew who could make these changes. They understood what the opposition was, but they also understood that the environment had changed significantly, and they had a time to pounce, and they did. We should do the same thing. You never know when things are going to happen and people want to take action. So being ready, I think, is part of that. And even while you're building, just thinking about, what would create opportunities that would be helpful to move forward. I can't give you those answers. That's really on the local and state level of where you're at, but just making sure that, if there are opportunities, you do jump on them, but you want to make sure that you have some of this in place. Sometimes you have to let things go because the time isn't right. All right, roles that people can play. I would love it if folks would put into the chat different roles that they've played. Have you organized a campaign? Are you that person who knows everybody? Do you connect? Are you that public health expert? Are you an organizer that you love to go out and work with people and pull them in? Do you watch the opposition? Are you the communicator, the one who does great writing, the one who can talk to the media, whatever level of communication? So could folks put that into the chat? Got a connector, expert, and communicator. Wow. And Carrie, I know that is true. Connector and the community organizer. I think a lot of times those go hand in hand. Definitely a connector.
Definitely. I love that the connector is such an important piece of bringing people together, and can be different than that community organizer. Communicator, which is great, community organizer and connector, networker. I like that framing of connecting and networking. Let's see. Opposition watcher, so I can be aware of how things are going on both sides. That's so important, just as Maureen had identified a moment ago. Connector, communicator, and sometimes subject matter expert. So true. That's so great. Like, use your strengths. Opposition watcher. Glad to hear people are doing that. And again, Maureen kind of underscored just a moment ago the importance of understanding what those opponents are up to, so that you can be up to the things that you need to counter their work. Connectors and communicators. We have so many connectors here, Maureen, that are working to connect prevention and other partners. I think that's about all I have seen.
That's great. I really appreciate that. So you understand the roles you can play, and then you know what else you need in order to round out your team. And so making sure that you've got that. I love people who keep me on time, organized, and accountable. And that's kind of your campaign organizer. We've talked about experts. I think most folks on the call here are experts in many ways. So we kind of got that covered. We had some people talking about community organizing, and I think that that is a key role. And sometimes, you know, in campaigns that I've been involved in, we actually hire an organizer. The key thing is you hire from the community, right? There are people who are gifted who certainly can come into a community and do a lot of that work, but I feel like the strongest way to do it is actually to have somebody from the community organizing. And that would go on several different levels of how you're defining community. We talked about opposition watcher, and then it looks like we've got some communicators. And if you don't have the communicators you need, go look for them. And there's often, you know, a lot of folks that are very dedicated and really want to see this kind of work happen that will be glad to volunteer or work with your coalition. So I think that's really important. Why do I have this up? Roles you can play? Because I think it's important that people understand roles that, you know, can be played and things you can ask people to do. Now, obviously, you need a little job description with some of these. But why did I get involved in a local alder campaign? Because they called me up and they asked me, and they said, we have this thing we want you to do. Would you be part of the kitchen cabinet? Well, yeah. I mean, you didn't say I had to change the world or I have to run the whole campaign. You said, I want you to do social media, or I want you to connect us to leaders in this ward. I can do that. You know, like given a specific role, that can be really helpful and make it feel less scary for folks in terms of getting involved in this ongoing thing where I'm going to be doing everything. So I think that's important to understand, you know, those different roles. But the reason why people do it is because someone asks them. And remember, asking isn't that hard, right? For holidays, have you ever asked for something you wanted? Of course you have. You know, did you want that cookie after dinner? Yeah. Did you ask for it? You probably did. And so you're already an advocate. You can do this. It's just inherent in living. So influencing decision makers' environment. And in some ways, we've been kind of talking about this already, talking about changing the narrative. And when I say hot button issues in the community, what I see is a lot of folks really concerned about violence, and they want to change that. And in the same like meeting, they're, you know, approving a ton of new alcohol licenses. Is there a connect? Can you help kind of draw the line for people between those things, right? So understanding what those hot button issues are and how you can, you know, pull that in. And it may be that you need to do an op-ed. That means you write a piece to the paper. And, you know, sometimes they're short, sometimes you get a longer opportunity. And then you can share that out on social media and try to get it in front of the people that you want to see it so they could hear your reasoning on how reducing alcohol density may also help reduce violence, right? So being able to tie those kind of lines. How can you, I mean, there's actually two questions in the second one. How do you become part of grocery store and coffee shop conversations? And then how do you impact those? And so that I can tell you that's when we knew we were going to win some of these smoke-free campaigns, is because people were just talking about it in the community. And then kind of trying to listen without being creepy. And find out that, again, I find that a lot of people just have wisdom. They understand where there's harm. And you're giving them, by running this campaign, the opportunity to express that. They kind of have air cover. And then we would hear these conversations that were often moving in the right direction. Now, obviously, it depends on where you are, you know, because other parts of the state didn't feel the same way. So, you know, it doesn't always, but when you get to that level, you know that you have raised awareness and that you can keep moving forward, keep pushing, because you're close to being able to make a big impact. So I think that's important. And I did, the create cover. I remember having a media consultant said, people are sick of talking about tobacco, or they're tired of talking about, whatever the issue is. Yeah, maybe, but I always have new news, right? There's always another research paper that comes out. There's always something that happens in the community and somebody makes a quote about alcohol being involved. There's always the opportunity to create cover. So you want to make sure that we are giving a good place for people to come to say they support making change. And you do that by having, pushing back on that other narrative, and being able to say that, like, it's not okay that there's a lot of excessive alcohol use. We can do that. So I've run a couple of tax campaigns, and we always talk about how it's for the kids, right? Like, we're trying to reduce youth smoking, youth drinking, whatever it is. But often the politicians are like, they want to pay for something, or they want to reduce costs, so there's kind of incentives to think about how that can happen. And by allowing messages that really work and are true, it may be not the exact motivation that people have, but if they're true, that can be really powerful. So if the public feels good about a tax campaign going through because it's going to reduce kids binge drinking, that's good and it's true. But they may have other motivations. But creating that cover so they can do the right thing, I think, is really important. I also think when we think about decision makers, and again, whatever kind of decision makers they are, it's important that as they change over, that you go back and meet the new people and talk to them and kind of bring them into the fold if you can. So just making sure you're keeping new leaders up to speed is really important. Obviously, give them a minute to get into the job, but I think that is incredibly helpful. I can't say this enough. You have to understand how people are using media. What are they listening to? Their audiences. Are there opportunities to create really meaningful conversations? There's a number of kind of talk radio shows around our state that have really great, meaningful conversations, and that hits, in an audience that's really important. Sometimes, it might be that you do a Zoom, a live Facebook kind of thing, but then you record it and allow people to listen to it later. So, thinking through kind of all of those strategies is important. I also want you to think about how people react to the media. So we often see, the alcohol industry or tobacco industry or the soda industry kind of getting their message out over and over again. And, I know when we were looking at New York passing their smoke-free air law, they had counted the stories for and against. It was 4-1 against going smoke-free. But the polling shows that going smoke-free was more popular than the New York Yankees. So there's media out there, and there's sometimes a point of view on that media, but it doesn't mean that everybody agrees. It does mean that you need to get your side of the story out so that you can help influence, where the conversation is going. And again, give decision makers kind of that safe place to come to say, there is support out for making these changes. All right. Thinking about capacity, this should be part of your plan, but I do think it's important to think about the time that needs, in order to happen. If you're kind of the center of the coalition, knowing what time your organization can put in, but again, asking other people to be part of it, I think is really important. What kind of funding, what kind of interest do folks have? So thinking about successful policy implementation. So now the policy has passed. And what happens? Well, sometimes people are like, oh, good, I'm done. But it's often not over, and most likely not over. So you do need to stay organized. You may need to change roles a little bit, and you still need to be able to show that it was a positive thing that decision makers did, because you may want them to do more, right? So for example, in our state, Chapter 125 is an important statute that local governments can either just automatically take in, so when the state changes the law, it's the same law is on the books locally, or they can vote to decide to do that. And I didn't even know that those things happened. I thought state law passed and everybody obeys, right? Nope. We actually had to go and look at communities that did not adopt that chapter, but actually had to vote in favor of that chapter in order to make sure that the smoke-free air law was implemented. And so that was a lot of work to understand that part of it. There's a rulemaking process that is incredibly important as well. And the rules would be like, how is this law going to be implemented? Who's engaged in this? And there's a lot of different administrative processes. You got to keep an eye on that. We've seen rule processes that are very in-depth and do a wonderful job of making sure that the policy as intended is implemented. We've also seen people overshoot and try to write more than what the policy was passed is. So they, thought that they could improve a law, right? Because there's some staff level, but there's also some appointed level folks in our government that make those decisions. And that appointed sometimes thinks that they can do things that they're really not authorized to do. And then it ends up maybe you don't get hardly any rules at all. And then everybody's confused. And that's where you have to step up as an organization and help give guidance. You can't tell them that that's the law or that's the rule, but you can help make sure that you give guidance. So that can be hard. It can be exhausting. Excuse me. We don't have the greatest air in Wisconsin right now. So when you think about policy implementation, think about it all the way through and how it actually looks on the ground. And so I think, and the other piece I want to say is, as your coalition does things, it is important to celebrate. It is important to acknowledge success, even though it's maybe not the big one. And then when you do pass some of those big things, please make sure that people are being thanked over and over again. Maybe you have a gathering, you do something, but you need to give yourself a little time and space to feel good about what you've done so that you have the energy to move on. And I know after big campaigns, people are exhausted, right? And then something else comes up and you've got to keep people moving forward. So it's really important, I would say, to do those things quickly. Maybe small, quick, and then, a little bit longer to bring everyone together, if, based on schedules, but it's incredibly important to do that. So I'd love to open up, it looks like we're getting low on time here. Just any insights that folks have had on watching some of these policy conversations play out? Okay, I'll go ahead. I touched a little bit on this. Policy is not over when it passes. Making sure there's some feedback and that people are paying attention and watching what's going on. Sometimes policies don't get implemented equitably. Sometimes there are consequences that we don't necessarily anticipate. So for example, taxes can be really helpful in reducing overall smoking or alcohol consumption, but it can be hard with those who have mental illness, those who are poor, that will come up for sure. And being able to think about how do you mitigate that harm.
And Maureen, I am so sorry, but this has been such a great conversation and we've learned so much. We are actually at time and I don't want to keep people past the hour. So I think we have a great summary here that we can go over super quick about a lot of what you've already shared. So if people want to just take a look at that while we move forward, or if you want to just run through that quickly, Maureen, and then we'll go into our final slides.
Sure. As I've said, planning is essential. Making sure you know what your big ask is and what you may need to compromise, including community voices, as we've talked again and again and again. Be ready to react. Circumstances change all the time. And there is also a network across the country within a number of organizations, but certainly American Public Health Association, willing to help you out.
Great. Thank you so much, Maureen. And we will have these slides up when we post the webinar, so if people want to go through them again. But that was such a nice summary of what you've already told us. So there's a link in the chat to our evaluation. You'll also notice that we have a number of upcoming events about facilitation, youth substance misuse, community coalitions, and continuous quality improvement. So please take a look at our website for those. And, the importance of advocacy. So we're gonna have another webinar that really kind of dives more deeply into advocacy and prevention and what it is and how we do it in a deeper way. So I think that's that. And then we have some new healthy knowledge courses. Encourage you to go check those out and use them. There's currently 41 courses on substance misuse. So take some time to go there and check those out. If you want more information on any and all topics, you can just hit this QR code if that's something you like to do, or go to that evaluation in the chat. And please take that few minutes just to provide us your feedback. We are so grateful that y'all stayed, heard, and listened to the expertise that Maureen brought and that you engaged in this conversation. It is truly helpful to our peers and wonderful for us to understand. So thank you so very much. And we, I think, have one more slide to just say goodbye or complete the survey. We'll leave it open for just a second so you can, take a picture of that QR code. I never know how to say. But thank you so much. And we're so glad you're here. So